Hello, this is Allison Ralston, Physician Assistant from Northside Medical. At Northside Medical, we really do care about our patients. We care that we get you the right information. Today, I'd like to talk to you about the overuse of antibiotics. There was a study that was done by Dr. Robert Elliott and Dr. Yang and Dr. Baucom, who are researchers and physicians in Baton Rouge, Louisiana. They wrote a paper called "Wake Up Doctor, We Are Causing Cancer. Antibiotic Overuse Causes Mitochondrial Dysfunction." What this paper discusses is that antibiotics, though they're important and they are valuable and they have a place, but the overuse may be causing mitochondrial dysfunction. The mitochondria, as you may remember from high school, is the powerhouse of the cell. It has to do with cellular activity and cellular respiration. Mitochondrial dysfunction has been shown in common diseases, particularly some neuromuscular diseases such as Parkinson's, Alzheimer's, and ALS, which is also known as Lou Gehrig's disease. In the 1930s, a man named Warburg linked that mitochondrial dysfunction was related to tumorigenesis or to cancer growth. So as we're already aware, you've already heard that we're developing antibiotic resistance. There's also evidence that overuse of antibiotics is changing the natural gut flora or the gut bacteria that we need, which is also maybe contributing to physical illness. Antibiotics, well, different classes of antibiotics actually target mitochondria. And by doing so, it's changing the dysfunction. So the theory is that this dysfunction may be leading to some cancer growth. So we know right now that antibiotics, we do have antibiotic resistance right now. We do know that antibiotics, some antibiotics can cause an overgrowth of C. difficile in the gut, causing severe diarrhea. We know that antibiotics can, in ways, affect our immune system. We also know that you've heard of people getting yeast infections when they take an antibiotic, and that has to do with killing off good bacteria and allowing an overgrowth of more harmful bacteria. Period. So why am I discussing this with you today? The reason I'm discussing about the overuse of antibiotics is that we at Northside Medical want to do what's best for you. If you have a virus does not respond to antibiotics. That's why many times we will try to treat you the symptoms and not give you an antibiotic, because we know that there is antibiotic resistance. And now there's some evidence that it may also be linked to some mitochondrial dysfunction and cancer growth. So I hope that's helpful to you. If you'd like to get a copy of that paper or want to discuss that with any of your providers, please do so. Over the course of the next few months, we plan to do more of these type videos discussing different health issues. The next one that I will be discussing will be Alzheimer's disease and what you can do to decrease your risk of getting Alzheimer's disease. Well, thank you again for joining me at the Northside Medical Health segment. I hope that it was helpful for you, and we look forward to doing more of these videos and educating our patients and giving you valuable information. Thank you again.